Well, to call multiple sclerosis a sneaky disease may be an understatement. Not only can the symptoms be hard to spot, it's estimated that people often go an average of 7 years between their first symptom and their formal diagnosis. March is Multiple Sclerosis Month, and here to tell us more about the early warning signs, Dr. Tarrel from Neurological Clinic and Abbott Northwestern. Welcome. It's good to have you here today.
Glad to be here.
What is MS?
MS, or multiple sclerosis, is actually an autoimmune disorder, and it's a disorder that affects the insulation around the nerves. So if you think of nerves like wires, wires don't conduct electricity like they should without the proper insulation around them. If you have gaps in that insulation, that covering of the nerves, then you don't conduct the information through the nerves that you usually would, and people lose function that way.
So what happens then?
People can get neurologic symptoms. So these are symptoms that can come on out of the blue. They're not an abrupt, sudden onset kind of symptom like a stroke, but they're symptoms that can kind of creep up on you, and they can be just about anything from sensation, numbness, and tingling to strength and loss of motor control, coordination. Many symptoms can derive from that.
Who most affected by this?
Actually, it's really interesting because most of the people that are affected by this are from northern climates. They're from colder climates, the U.S., Northern Europeans, Russians. It's not a disease of the tropics, and it does affect women slightly more than it affects men.
So women affected in age grouping of this typically?
Most people are at least 20 years old, and the common age group of onset is between about 20 years and 60 years old where you first get the diagnosis.
I thought it was very interesting. The symptoms and then the actual formal diagnosis, that's an enormous gap in between. That's why it's called sneaky.
Let's
address some of those again. Chronic fatigue is one of the early warning signs of it.
Correct. Fatigue, and this isn't just a fatigue that you can sleep off or repair with a nap. This is something unusual. This is an unusual chronic kind of tiredness that affects people that they just can't get rid of.
Walking difficulties?
Walking difficulty as well. Again, maybe due to loss of coordination from those nerves being affected, those parts of the brain or the spinal cord, or strength can affect your walking as well.
Tingling or numbness?
Tingling or numbness, which is a difficult symptom because as physicians we can't see or touch that, but people will feel that. And again, it's not just an easy tingling hand that was cold. It's something different that people will feel qualitatively different.
Issues with vision?
Vision also. That's one of the more common symptoms that people get, and sometimes, especially in women, it could be the first symptom that comes up because it can affect the nerve that goes to the back of the eye, and it can affect vision that way, sometimes in one eye, sometimes both eyes, and there's not necessarily pain or other feelings to it, but you lose your vision.
Well, thank you for starting the conversation today and educating us. We appreciate you being here.